afternoon, everybody. Jim Toth with the Jim Toth Show, and very proud and happy to be a big part of the 2024 Innovation HSC Radiothon here at HSC. Go online at hscfoundation.mb.ca/donate. You can call 204-515-5612, call toll-free 1-800-679-8493, or text, this is real quick, real simple, HSCF to 20222 to donate $25. The Innovation HSC Radiothon is a day when we share inspiring stories from Manitobans who, like so many of us, received exceptional care at HSC Winnipeg, Manitoba's hospital. Research and healthcare teams will also provide insight into their work at HSC and will share how HSC Foundation donor and partner generosity helps patients. We're going to get right into it because we are jam-packed with some great stories. And we welcome in Dr. Ed Buchel, who's going to speak to HSC Foundation's Operation Excellent campaign. Dr. Buchel, thanks for joining me today. How are you?
I'm great. How are you?
Good. Thank you very much. I appreciate you coming down. I know you're doing great. You look great. How is everything with healthcare and what you're in charge of with this program?
Healthcare is, not as bad as people think it is in the media. There is obvious areas that we have to improve, and that's why, the HSC Foundation, the Department of Surgery, the government, and everybody is working together collaboratively to move surgery forward as quickly as we can. We all know there's people on waitlists. We all know there's people suffering. There's a lot of good things going on right now. Operation Excellence through HSC Foundation is a core building block that we use collaboratively to move clinical surgical services and other surgical services forward at HSC and for everyone in our province.
Excellent. I mentioned the HSC Foundation's Operation Excellent campaign and the importance of minimally invasive surgery, one of the pillars of the Operation Excellence campaign. Tell us about that.
Yeah, well, the name kind of is a play on words, operation to be operating, and excellence. We want this pathway to not just deliver routine care, but to advance care so we can deliver better care, less invasive care, quicker recoveries, less time off work. We want to do more by buying technology that extends my eyes, my hands as a surgeon, the ability to deliver more precise surgical care, because that means quicker recoveries, less morbidity for patients, less time off work. You get back to see your family, you get back to work, you recover quicker, and we do more with less if we buy the technology. So we've asked our system and we've asked our care providers, what do you need to deliver better care? We're working on the staffing. We're recruiting more people. We're buying the technology now to deliver excellence in surgical care. That's how we move things forward. It's exciting to be part of the best. It's exciting to deliver better care than I delivered yesterday. I recruit people to that. I retain nurses for that. It feels great to deliver better care.
Right. I can imagine. Never easy, though. How is the challenge this past year?
We went through COVID.
Yeah.
We're going through a reorganization in the healthcare system through shared health. These are all incredibly optimistic times. We have, a change in government that is fully behind moving healthcare forward. We are looking with the foundation that we have a huge path forward and momentum to move surgery forward. All I have is partners around me that are wanting to deliver more care. We're developing the plan, and everybody moves forward, especially at HSC. Like this is Manitoba's hospital. It's for everyone, no matter where you live. It is our major tertiary care center site, and everybody is coming together around it. The HSC Foundation is a pillar to moving this forward in the surgery program.
Well said. Well said. I also want you to speak to, you mentioned about this, one of the fundraising priorities for the HSC Foundation. It's a portable handheld device that provides surgeon with high definition, real-time blood flow visualization. Tell us about this and how you're trying to acquire that to speak to what you first answered about making everything less invasive and more quick.
Yeah, this is extending my eyes. I can't see the blood flow in your body very well, but using special types of imaging, and we use special types of dye that we can put in your bloodstream, not a problem for you. And then we activate this dye and we can pick it up on different photo sensors and we can show where the blood is going. That is important because almost every surgery has to interrupt blood supply to some degree. When we do, we want the residual tissue that we leave behind to have enough blood supply to it to heal. This tells us where there's blood, where there isn't blood. Our breast cancer patients use it a lot. Some of our thoracic patients, our general surgery patients, all of these, when we take out tumors and then we put what's left back together, I want to know that the tissue that I'm putting back together is going to live and heal without complications.
I think I've interviewed you before. Well, I know I have, and I feel bad because you sat down, we were chatting, and I said, you look tired.
Yeah.
I didn't mean to be rude about that, but I did want to ask you about it. Like, how busy are you right now? Clearly, the phone's ringing, so you're very busy.
Yeah.
How busy are you right now in you yourself and your department?
Yeah, we're very busy. And the problem with a lot of the stuff that we do is, we're struggling to triage patients and make sure that we're not letting anyone fall through the cracks in our system. We understand there's increasing need, there's increasing demand for our surgical patients. We have increasing demands now for medical patients throughout our system, and we all work collaboratively together. Our care continues no matter what. Our nurses show up day in and day out here. We are the last stop, and we backstop every hospital in our province. Like, this is Manitoba's hospital. We don't say no to anything. So we're busy. It's great work.
Yeah.
It's really rewarding work. We would rather not have as much of it, but it's incredibly rewarding work.
Right. And I appreciate you telling us the picture because that's what gets people donating is, these people are caring, they are working hard, and they do need some help. And, you're not just, I know you don't want me to do this, but I'm going to do it, Dr. Buchel. You're not just talking the talk, you walk the walk. Dr. Ed Buchel, HSC's Surgery Site Director, my guest right now, along with the HSC Department of Surgery, are donating $10,000 as a matching challenge for gifts to today's Radiothon. You have till 6 p.m. today to take Dr. Buchel and the Department of Surgery up with their $10,000 challenge. That's amazing and really speaks to how much you care for the program.
Yeah, like this, if I want others to contribute, then the surgeons will contribute. And we would hope that all of the departments, medicine, etc., all come up and step up. We're all part of HSC. We all benefit from the work the foundation does, and it's how we care for our patients. It's how we move healthcare forward. So, absolutely.
Great stuff. Always a pleasure talking to you. Thanks for coming down. Thank you so much for the donation, and please, you and your whole department, keep up the great work.
Thank you very much.
So $10,000 challenge by Dr. Buchel and, of course, the HSC Department of Surgery. Yeah, I heard a cowbell somewhere. We can ring the cowbell for that. That's outstanding. And to do so, you have until 6 p.m. to take Dr. Buchel and the Department of Surgery up with their $10,000 challenge. To donate, please go to hscfoundation.mb.ca, call 204-515-5612 or 204-515-5612. That's the same, sorry. Or 1-800 is the toll-free number. 1-800-679-8493. And a real quick way is text HSCF to 20222 to donate $25 automatically. It's the HSC Innovation Radiothon on the Jim Toth Show on 680 CJOB.